struggling after a long, cold winter, you're not alone. Dr. Kelly Sullivan with the Sullivan Surgery Center is here to explain how to get your summer glow back. And thank you for being here with us this morning.
Thank you for having me.
Well, what are some common winter skincare problems? People have dry skin, obviously, probably.
Yeah, the most common is dry skin, and it's really from the cold weather and obviously the heat being on indoors. So coming out of the winter months and getting ready for the spring and summer, the best thing to do is to really exfoliate your skin. You can do it at home, or if you want to be more aggressive and do an in-office treatment, a combination of like a microdermabrasion where you're removing the top dead layer of cells, and then following it with a nice light acid peel to really get in, stimulate the collagen, tighten the skin, get a nice healthy glow is a good way to get ready for the spring.
And it is, we're seeing it get a little bit warmer every week, so now is the time to start thinking about that and doing that.
Great time to do that, and then hydration. So a lot of people are afraid to use too much moisturizer. They think they don't want to get oily or greasy, but even oily skin really needs a good moisturizer. Something with hyaluronic acid is a great thing to replenish the moisture in the skin. And then another way to get a nice healthy glow without getting sun damage is a nice spray tan, or something using some products that can give you a little bit of that glow as well.
Exactly, that's keep healthy.
Yes,
and
healthy.
I bet you would definitely want to be perfect. You don't want any dry patches if you're getting a spray tan.
Right, no dry patches. So you definitely want to exfoliate, and that is something you need to do on a regular basis because the dead cells build up, and if they're blocking your skin, then the moisturizer can't get in and do what it needs to do at the cellular level.
Okay, and at home, do you advise different routines for the night versus the morning? Extra moisturizer maybe?
So the main thing in the morning is you want to add sunscreen. So if it's not already in your moisturizer, which it is more and more in a lot of products, you definitely want to add that on top of a moisture. So moisturize, then moisturize with sunscreen. And then at night, you really want to focus on the hyaluronic acid so that while you're sleeping, that can get in and really moisturize and plump up the cells.
Okay, and I know you touched on this briefly, but if they want to come see you, get an in-office thing, you can do something a little bit more.
Of course, yes. We have a fully certified medical spa, so we can do a little more aggressive treatments, or actually a lot more aggressive than you can do at home, supervised, in a medical setting, so it's nice and safe, but it really kind of is designed to aggressively hydrate and exfoliate your skin.
Okay, and let's talk about your spa. So you said you're in Annapolis.
In Annapolis,
okay.
Yes.
People come from all over?
Yes, we're right off Route 50, so it's a pretty easy, coming from the Eastern Shore, Baltimore, D.C., and also from within Annapolis itself. We're Sullivan Surgery and Spa, so I'm a plastic reconstructive surgeon, so we have the full-blown surgical treatments, but we also have a full medical spa with several estheticians who are amazing, and nurses, and a great team, and we're all women, and we all understand
sure.
what it is to have dry skin and want to kind of refresh everything.
And I feel like women take this more, but men do need to think about this
Absolutely.
as well, right?
Oh, we have a lot of men who will come in for treatments as well, because especially men, because they're not doing much at home most of the time. So if they're not willing to do that everyday kind of routine, which doesn't have to be crazy long or difficult, but we can help by coming in about every 6 weeks is an ideal time, or even if just once a year if you say, I want to do something great for my skin. We have a lot of men who will come in for that too.
Okay, Dr. Kelly Sullivan, thank you for being with us this morning.
Thank you for having me.
I appreciate it. Well, coming up next.